In terms of public health, it seems like the toolkit, at least in Mississippi, was pretty much directed at hospitals as opposed to other statewide measures. There's a sentence in the article that there were no other mitigation measures taken in Mississippi after, I believe, May of 2020. So I was wondering, in the evidence that you presented in this paper, is this in terms of being policy relevant, is it more directed to other sort of similar states that are under-resourced, or are you hoping also that it's perhaps a wake-up call in a sense to invest more in resources in Mississippi so that you aren't limited to this set of hospital interventions? Would you like to discuss that in some, more detail?
Yeah, no, that's an excellent point to bring out. I do think that if you consider every health system has a breaking point, and certainly I think we saw it in states that are more resourced, right? Like New York, New Jersey, and New England. And so, I think the lessons from our observation might have some bearing, because I think a lot of the healthcare system, although it may well be that our elective ICU utilization rate's higher than average, but it's not that much higher if we look at other places. But if you think about in the context of public health response in Mississippi, the South in a lot of places didn't really engage aggressively in the community, like the community-based interventions, the masking and the school interventions, things in public, limiting gatherings. When I went to New England to look for college for my youngest kid, we were wide open, and we still had like third capacity in the restaurants, and you had to wear masks and all that kind of stuff. So it was a tale of two cities, right? I mean, we had people who were doing stuff and people who weren't, and we were mostly weren't doing things. What we did was in the context of what we had power to do. And what we had power to do was try to protect the health system. Although, we didn't have a ton of support, although we had some from other avenues of government, but we intervened where we could, and we had authority over, in our licensure, we over nursing homes and over hospitals, and where we had that responsibility, we tried to exercise it in a way that was appropriate, hopefully effective, but also collaborative. And all part of this whole thing, we had weekly regular meetings with CMOs and CEOs. And I think, that's one of the good things about Mississippi is everybody is kind of interconnected. And so we had strong relationships to create these networks. But also we're more challenged. And, it would be great if we could, I know there's some stuff out there, but have a better sort of evidence base around the other impacts that probably really worked, but we just don't have as much, numbers to define the impact.